Well, hello, and welcome to the Alzheimer's Association Warning Signs of Alzheimer's Disease. I'm Stephanie Rolfs-Young, the Senior Director of Program Volunteers and Community Engagement, and I'm so honored to be your discussion host today. I am joined by an all-star team of Alzheimer's Association volunteers, including Pippi Rogers, who has been a care partner to her mother, who once experienced Alzheimer's disease herself, and is also now currently an advocate for the Alzheimer's Association, a community educator, and a member of our board of directors in the state of Georgia, where she serves as the vice chair of the board of directors. And Arthena Caston, who herself was diagnosed with dementia at the age of 51. And through her advocacy and her work with the Alzheimer's Association, she not only also serves as a member of the Georgia Board of Directors, but she is also a member of the Early Stage Advisory Group and recently joined the National Alzheimer's Association Board of Directors. Again, we are honored to have these guests with us today and so pleased that you joined us. What we'll discuss today are the warning signs of Alzheimer's disease and allow you to hear firsthand what it's like living with dementia. We'll discuss the importance of early detection, how to talk to a doctor or somebody that you're concerned about, and how to get a diagnosis, and of course, where to turn for Alzheimer's Association resources and support. So as we begin, I think every good conversation about Alzheimer's or dementia starts with understanding the terminology. And as you can see on this next slide, we want to give just a quick high-level overview to these two terms that are sometimes used pretty interchangeably, but mean very different things: Alzheimer's and dementia. So to start with, dementia is a general term for a decline in memory, thinking, and any reasoning skills that are severe enough to interfere with a person's daily life. There are lots of different types of dementias. And in fact, dementia is not a disease in and of itself, but rather describes a group of symptoms that are associated with decline in memory, reasoning, or other thinking skills. When we hear about dementia, we often make the association to Alzheimer's because Alzheimer's is the most common form or the most common cause of dementia. And Alzheimer's is a very specific type of disease, whereas dementia is not. In fact, Alzheimer's is a degenerative brain disease that is caused by many complex brain changes that really are followed by cell damage. It leads to the symptoms of dementia, and in most cases, Alzheimer's gradually worsens over time. Through this webinar, we'll discuss the common early warning signs of Alzheimer's and dementia. And it's so important that all of us are familiar with these 10 warning signs, not only to make sure that we're looking for the signs in ourselves, but also in the people around us, our friends, our neighbors, and our loved ones. As you can see in the next slide, we'll talk about the signs as we want to all be alert to them and be on the lookout for any kinds of changes. The signs that we discuss today do not constitute a diagnosis of Alzheimer's or dementia. These are simply the most common examples of changes that people experience. And it's important to remember that people may experience one or more of these signs and to varying degrees throughout their experience. In other words, this is not a checklist, and you certainly don't have to have all 10 signs in order to be concerned and to take action if you or somebody that you care for is experiencing any kind of change. Finally, some changes can be due to other medical conditions, so it's always important to talk with a doctor and understand the changes you or somebody else is experiencing. And the sooner you can have that conversation, probably the better the outcome for everyone. So let's talk about the first 3 warning signs of Alzheimer's disease. The first is one of the most common signs of Alzheimer's, especially early on, and that's forgetting recently learned information. In fact, people will say sometimes that their loved one is really good with past memories, things that happened 20 or 30 years ago, but may begin forgetting important dates or events, or repeatedly asking the same question, or even having to rely more frequently on memory aids or kind of leaning on others for things that they once easily remembered. A typical age-related change for all of us is sometimes forgetting that one little nugget of information, but most of the time remembering it later. So it's important to distinguish here that we're really looking for recently learned information and how much this may be impacting a person's everyday life. In the second warning sign, we hear often that people will experience new difficulties in executive function, including developing or following a plan, or even having difficulty concentrating. Probably many of us on this example today have had an occasional error when you're paying your bills or managing your household finances. But most times you can remember later that you need to do something and you can take that appropriate action. For somebody who's experiencing early stage Alzheimer's or experiencing the symptoms of dementia, it may not be easy to retrace those steps and be able to figure out what it was that you intended to do. And lastly, the third warning sign is that people living with dementia often find it hard just to complete the everyday tasks that used to be so simple. Things like driving to a familiar place, or writing out a grocery list, or even remembering how to play a favorite card game. All of us can occasionally need help using a microwave or using a remote control or even learning new technology. But when any one of these signs begins to happen more frequently or begins to interfere with the day-to-day function of a person's life, that's when we absolutely want to take action. So I'm pleased to introduce to you today Arthena Caston, and I'm going to throw the first question to Arthena and ask you, Arthena, when you were first experiencing some changes, which of these signs did you first notice?
Good evening, and thank you so very much for inviting me. Actually, Stephanie, I think I experienced almost all of them, almost every single one. It started with something as simple as forgetting how to, a job that I had been going to for 20 years, all of a sudden became something new to me. I couldn't do simple tasks, answer simple questions, and it just got little by little became worse. Soon I had something as simple as I was trying to help plan my daughter's wedding and totally forgot that I was supposed to contact different people to do things, such as having a planner do this, or it just got to be too much. I just couldn't remember. And little by little, it got to the point where we had to actually get a professional planner because I couldn't remember.
Mm-hmm. So it sounds like at first they were pretty subtle little changes that any one of us could overlook, but then it sort of started to creep in more frequently. And we hear that a lot of times, right? That people notice little changes and then they start to almost compound themselves. And I'm curious, Pippi, from your experience being a care partner with your mom, how do you see signs number 2 and signs number 3 being different? Because they really seem very similar on the surface.
They do, Stephanie, and thank you for asking that because I am one of 4 care partners, or was, for my mother. Raising 5 children, my mother was very scheduled and a big planner. So the things were solving problems, simply things like she might find that she's got scheduled 2 things on the same day. For instance, her hair being cut and a doctor's appointment. And she could not seem to be able to problem solve to just simply make a phone call to make one another day or to cancel one. So she was having issues with that. She also had issues with one of the things that happened was she did things in a certain order all the time when she was preparing dinner. And she, long before she had her own microwave installed, she loved them knowing other people had them. So she always seemed to make something in the microwave. And at one point, she had put something in the microwave and wrapped it in aluminum foil. And she was always very particular about what went in her microwave. And here she was doing something like that. So it definitely is something that showed itself a little bit and then increased in time as she progressed through the disease.
Both of you share examples that I think we've heard so many different people say, that at first it's a little sign, but then after a while, it's like, well, that really seems out of character for that individual. And I applaud both of you for taking early action to really try to figure out what was going on. You know, as we look at the next three signs, signs 4, 5, and 6, I think it becomes more apparent at this point that somebody might have something going on that's not quite their normal baseline. So in the example here with the fourth sign, when an individual living with Alzheimer's or another dementia loses track of dates or even seasons or the passage of time, it might be that they're really having trouble understanding something that's not currently happening, or they're getting a little bit more confused about where they are and how they got there. We see this certainly becoming more dramatic or profound in the middle and late stages of Alzheimer's disease. And any one of us could certainly get confused about what day it is. And over the last year during the pandemic, that has been such a typical experience for so many of us. But understanding that you have a scheduled appointment and then realizing you missed it and figuring out what action to take, those are some of those kind of executive functions that we just talked about that we want to look for a change in. And if you see a change, then obviously we want to talk to your doctor. We also recognize that some individuals with Alzheimer's or another dementia may experience visual problems or difficulty with balance or trouble reading. Even problems judging distance and determining color and contrast can become a little bit difficult. All of those impact driving or just navigating the environment around them. And while we certainly recognize that vision changes like cataracts are more typical with age, we can easily screen for cataracts and realize if it's a true vision change or if the change that we're experiencing is more related to dementia or Alzheimer's. And we know that dementia and Alzheimer's aren't just changes in memory, but they can affect the whole brain and how that brain functions in our space. And then lastly on this slide, you know, we often will hear that individuals have trouble following or joining a conversation, or might stop in the middle of a conversation and forget what they were talking about, or find that they're constantly repeating stories. We find that people, as they're living with either one of these conditions, may struggle to find the right word or call things by the wrong name. For instance, I'm sitting in a chair, but somebody might not remember the word chair and struggle with trying to come up with that. So they create a descriptive term to describe the chair. Parthena, I'm so curious. You shared with me one time that reading has just always been a lifelong joy of yours, that you're finding a little bit harder now. Can you talk a little bit about that experience?
I've definitely always loved to read. My whole life, I've always loved to read. And now I've gotten to the point where I can't read anymore. I cannot read, to be honest. I'll just be honest. I have a lot of problems reading magazines or books or anything that would take a long time for me to read. So now, but I laugh and tell everybody I have my Alexa read for me. She reads everything for me. My Audible, well, she does most Audible for me. So I'm not missing all the great books that's coming out because I just put it in my Alexa, and that's the greatest thing that's happened to me. And I love it. I have one in every room. I can read all across my house if I want to and not leave the room. So I love that. That is the joy of that.
That's fantastic. And what a great way to use technology to help you manage. You also mentioned me one time, Arthena, that you were having a little bit of trouble keeping track of the days of the week. And in particular, you mentioned laundry day. So how have you made an adaptation around what you're experiencing with your memory with that?
My worst day, I do have a very bad problem keeping track of what day it is. So what happens is Tuesdays is laundry day in my house. And I have a great husband, a great caregiver. And what he does is on Tuesdays, he pulls the basket out into the laundry basket out into the bathroom for me. So when I go in to take my shower, of course, the laundry basket is sitting right there. And that lets me know that it's Tuesday. Otherwise, we probably would never get our clothes washed or something. I don't know, because I just walk right by Tuesday and don't even think about it. But that is a great thing about having him, because he keeps me on track. And again, Alexa pulls into day then, because I can also ask her what day it is. So I'm just loving that fact that I can, the little niches are helping me all around my house, keeping track of time for me, helping me with recipes, everything. But Tuesdays is the day I always remember, because he pulls that basket out for me every Tuesday morning.
It's a great way to describe how you've managed to deal with the memory change that you've experienced and still create an experience for yourself in your own home where you're able to function really well. And that's what all of us certainly strive for. You know, as we think about the next signs that come up, signs 7 and 8, we certainly know that misplacing things is a sign that often causes concern in people. And I want to be really clear that this is not just about losing your keys occasionally or misplacing your wallet. We've all done that, and it's so aggravating when it happens. But we generally find that when you misplace something, you can retrace the steps to find them. And that's a really critical element, being able to figure out where you would have left it or used that item last and trace back. A person with Alzheimer's disease or dementia may lose things and may not be able to recall when was the last time that they saw them, or try to figure out where they might have placed them. Or people might start putting things in really unusual places, like putting a pair of shoes in the refrigerator. Because of that lack of executive function that we talked about and changes of awareness, the person may actually grow increasingly suspicious of others or start accusing others of taking their things or putting them in strange areas. So this is certainly a sign that we want to be really attuned to if we see the change in somebody that we care about. And again, on this slide, you know, not everyone experiences some change in judgment or decision making, but occasionally people will say that they feel as if their judgment isn't as good. And especially when it comes to things like dealing with money or paying less attention to their own hygiene or how they keep their house up. Those are kind of the common signs that we often hear about. And that's particularly easy to recognize in people who live alone. They don't have anybody else there watching, and it's pretty easy to get in that pattern. And again, I want to distinguish that we're not overly critical when any one of us makes a bad decision once in a while, like forgetting to get your oil changed on the schedule that you wanted to. But when you start to see these symptoms occurring on a more frequent basis, that's when we really want to raise the alarm and have the conversation with ourselves and with others about what might be underlying these signs. So, Pippi, I'm curious from your perspective, when you were starting to notice some changes with your mom, what jumped out at you first?
Well, making excuses for things. And also, my mother was an avid reader, and she was a real wordsmith, and she was very social. And she just, things that would have been common sense just weren't there for her anymore. Things such as she did get accusatory. I would say for probably 6 or 7 months, and she had this thing where she would always feel like people were talking about her. And she would do this little, mostly just with family, but she would do this little thing, and she'd just throw like a little hissy fit, and she'd get up and, you know, run in the bedroom and slam the door. And then a few minutes later, she wouldn't even remember that she had done that. And her poor judgment was when she got her car keys taken away from her. And unfortunately, my father did not choose a good hiding place. And she did take the car, and she had an accident and could not even reason as to what happened. She just told us that this pole jumped right in front of her and hit her. And so we knew then that, you know, it was time to definitely not just take the keys away, but the car. So yes, it was a hard time, but you did see throughout her disease when she was still verbal that these things continued and they just increased when they happened.
Mm-hmm. Yeah. And Arthena, you shared with us the other day that, you know, as you've seen changes in your own memory and you've thought about how your relationship with your husband continues to evolve, you mentioned that you really lean on each other for support. Do you want to talk a little bit about that and how you've been able to have him there as your support?
You know, I, I tell everybody that, you know, to have a great caregiver is the best thing could happen to you. And my husband has always been there for me from day one. He is not faltered, not one bit. He is always there. He makes a point to on Sundays, make sure he takes me out to enjoy life itself. Just even if his basketball game is on, he will take me out. But the best thing about him is that he got me a little job so that I would not be home by myself during the pandemic. And even afterward, he went to the point of, you know, going to his supervisor, his boss, and saying, I need to have my wife out of the house. I need her to be around other people. And so he says this, and I know he means it. He says this, he says, I got my wife this job because I want to save her life. He says that all the time. And that means because he wanted me not to be at a place where I was digressing and being lonely. And so I'm telling you, the relationship we have is awesome. He takes me out for ice cream and all kinds of sweets. He even takes me shopping. And I love it. I love it to death. I think this is the best I don't know. I can't even say it's the best we've ever been in life, but it's really, really close to it.
Wow, that is so inspiring. And, you know, as I think about the relationship that you have, you obviously have been very open with one another. And as we close out talking about the different warning signs, signs number 10, 9, and 10 really speak to how sometimes people aren't very open about this. And a lot of people will describe that it's hard to still stay engaged with family or with social things that you used to like to do. And, you know, sometimes the changes that are related to dementia kind of almost force people to feel like they're starting to lose their interest in following a conversation or beginning to start a new hobby. And you might see people starting to withdraw from those social encounters. So I'm so glad that you've not done that. We also hear oftentimes that people who are living with Alzheimer's or another dementia may get confused or suspicious or even depressed and fearful or anxious about the future. And certainly we know that any one of us can have this experience. And, you know, again, the last year has really tested all of us in terms of our resolve to stay positive. But it's oftentimes the case that people will say, you know, it's just awfully hard to take the day to day and not get upset at home or with a loved one or somebody that I'm familiar with when I'm out of my comfort zone. So Arthena, I'm curious. You mentioned to me one time that it's pretty easy to find yourself withdrawing. Even before the pandemic, it would have been easy to do so. Tell us what it's like day to day and how do you keep yourself positive and focused?
You know, the person I am, when you get to know me, my husband always teases me and says that I'm a person that will talk to a door if they will talk back. He always says that to me. And everybody who knows me knows that I'm that person. So when he started finding me at the place where I would look so forward to him coming home, it was almost at the point where I was calling him every day and say, what time are you coming home? What time are you coming home? He knew right then something was wrong because I was at the house. I was here by myself. I'm looking out the window every minute of the day and saying, because I'm not tracking with time to know what time he's coming home. And if he was a little late, I would just get so upset. I really would. I would get so upset because I was like, where is he? So he got to the point where, you know, he sent me to visit my daughters for a while in Florida. And then he said, that's when he came up with the great idea of getting me the job. And so it started out with a 2-month job. And unfortunately, I'm still at the job. It's been since October. So he's making sure, like I said, he's making sure that I'm being taken care of. He kind of holds me real tight to make sure that I'm taken care of all the time. But at the same time, he is the person that is very honest with me, who's very forthright with me, and is always the person that I can lean on and say, I'm having a problem, or today is not a good day. He's going to be that person and say, what's the matter? I couldn't have asked, I know I say this all the time, I couldn't have asked for a better person, but him being there with me has made me stronger. And it made our journey that we're going with now, not just my journey, but it's our journey. And that makes it all the better.
So important to have a support network wherever you find that and however you find that. And Arsina, I just appreciate your courage for sharing such a personal story and allowing people to see what it's like to live with dementia and what it feels like in the day-to-day. So I'm so appreciative of this. And as we wrap up talking about the warning signs and we start to think about now what do we do? It's so important to remember that these warning signs are just a guide. They're there to help us identify those problems in memory and thinking and behavior that may be related to Alzheimer's or dementia, or maybe something else totally different. And what's important, again, to recognize is that you don't have to have all of these signs in order to take action. In fact, some people have such variance in the signs or may have varying degrees of impairment that it's hard to put together a complete puzzle and really understand what's going on. And sometimes things get better for a period of time or may get worse. And then, you start to question yourself and what you're seeing. Is it really something that you should be concerned about? So we encourage at the Alzheimer's Association that folks have important conversations and discuss any changes that you see in memory, in thinking, or behavior, either in yourself or in someone else, with your doctor. And if you continue to observe these changes, it's so critical that you plan to take the next step and have a conversation with that person or with somebody else who's close to him or her about what you've noticed. So many times it's hard for the person who's living right there in the same household to recognize it because they see it every day. Mm-hmm. But from a distance, you can recognize that there's a change that is not that person's normal. And when you see that, it's critically important to have that conversation and to be the friend or the family to stand up and say, I know this is a difficult conversation. This may be uncomfortable, but I really want to approach this with you because I care about you. And I want to understand if you're seeing the same thing or what we could do together to get you some support. So I'm curious, from your perspective, Arsina, who really approached the conversation first about the symptoms that you were experiencing at work or with planning your daughter's wedding?
It was kind of a mixed thing with both me and my husband, because I knew something was wrong, especially after I left the car running at work one day. I definitely knew something was wrong. But as I said, I had been going to the doctor. I didn't think he saw it, so because I hadn't gone to him for so long. And every time I would come home and talk to my husband about it, he would say, write it down. But then he kept asking, you're having the same symptoms. You're having the same symptoms. I don't see anything changing. You're getting all this medication. Something else is going on. So we kind of bridged that together. And when we got to that point that we knew, he was there with me when I got the diagnosis. He was the one that was doing all the talking, which is kind of odd because my husband was a very quiet person, but he was doing all the talking and saying, what are we going to do now? That type, and so I think back to, my daughters knew, or the daughter that was really helping me with the wedding, they knew, but no one ever said anything. It was just like, we're not going to talk about it. But my husband said, there's something wrong. I know something is wrong. So I'm going to kind of give it to my husband as usual. I'm going to give it to him and say, yeah, we need to go to the doctor.
Yeah. And such a hard conversation to have. Any one of us who has had that conversation, it is so hard to initiate that, but such a critically important conversation. And I'm curious, Pippi, from your perspective, so you were one of many siblings, probably seeing things from a distance. What was your experience like as a care partner when you started having these conversations with your own mom?
Well, she, of course, was in denial, but I'm going to say, Stephanie, that my father was harder to convince than my mother. He was pretty much in denial. And because there were 5 of us, and a lot of it came from my younger sister who lived the closest and would see my parents on a pretty normal basis. It was difficult, but she realized that she was doing things that didn't make sense to her. She would constantly ask, "What is wrong with me?" And we got to have those conversations. I just wish in 1992, when my mother was finally diagnosed, that there would have been the Alzheimer's Association and the 10 warning signs, and we could have learned a lot sooner about some of the things that were happening with her and been a little bit more proactive. Um, it definitely was something she saw in her own mother, so she could kind of relate to some of those things, and we could have those conversations. She was very open to it, but it was difficult to actually get that diagnosis. So we saw a lot of those signs before she actually got to where she had the diagnosis.
Yeah. You know, as you say that, Pippi, I think one of the things that comes to mind is certainly the conversation has evolved since some of us on this call had to have that conversation with a loved one. And it's very different today now that there are treatments and medications and, you know, so much more hopefulness than there was back in, would you say 1992? I mean, my goodness, the disease was barely studied at that point. And Arthena, I'd love to ask this question of you. If somebody is hesitant to have a conversation with somebody that they care about who's exhibiting problems with memory, what would you say to that person to help them overcome their hesitation?
I'm going to say, what's what I want to say. It is not great to say that, and I'm having problems with my words, but even though you may not want to have that conversation, it's a must. It's a must. It's a must, because if you go out and start with the conversation and talk about it, even though a person may deny it and deny it and deny it, the earlier you have the conversation, the better it is. I can't say that enough. The earlier you have the conversation, the better it is. Because if you do or are exhibiting those signs, at least even though there may not be a medication now to stop it, there may be something to slow it down. When I talk to people, and I talk to them frequently, I say that all the time. At least you can maybe slow it down. Once it gets to a point where you can't, or you let it go for 20 years and you didn't say anything, you can't say anything. It's almost there. But if you say right now, you know what, Mom, I noticed that you're not doing, or you did something, so forth. Maybe we need to go have a doctor check you out. It's so much easier than to wait. I can't say that enough. Oh my gosh. I can't say that enough.
Yeah, it's so hard to have the conversation, but to your point, to live with that feeling of wishing you would have done something different is really tough as well. So I applaud both of you for having those conversations early and taking action and getting the support that you need as you're thinking about what this next part of the journey is going to look like. And we absolutely want everybody on this session to think about what they can do to get support. And as we think about where there is help available, we know that when somebody is exhibiting the symptoms, they may not always be aware of it, or even people close in the family may not be aware of it. But it's so important for people, whether they live alone or whether they're close to family and friends, to get to a doctor and to get evaluated. and make sure that you're really honest and open with those healthcare professionals about whatever kind of memory loss concern there is. Knowing that you've seen some changes in somebody is a starting point for the conversation. And actually learning more about Alzheimer's or dementia can help people ease that anxiety to prepare for whatever the next test is going to be or whatever that next piece of the journey is going to look like. We know that there are all kinds of conditions that cause memory loss or affect thinking or affect behavior that are not Alzheimer's or dementia. So it's important to get a full workup and understand in that medical evaluation really what's going on. And if the cause is not Alzheimer's or dementia, then it could be another treatable condition. And it would be tragic to imagine that you didn't take action when there was something that we could have been treating. If it is dementia, then there's so many benefits to receiving an early and accurate diagnosis, including the opportunity to plan for the future, to think about getting support services for yourself and for those around you, and exploring the medications and treatments that may help delay those symptoms for some time. We also know that getting an earlier diagnosis helps you get linked into information and support. And through the Alzheimer's Association, we have a 24/7 helpline that you can reach anytime at 1-800-272-3900. You can speak to a master's level clinician or social worker about your concerns and really figure out what those next steps should be. You're also welcome to go to the Alzheimer's Association and AARP's Community Resource Finder. And you can find that at communityresourcefinder.org to find local resources such as a healthcare professional or your closest Alzheimer's Association chapter to you. We have a training and education center that you can visit to take any online course and even learn more about a variety of topics like more information on Alzheimer's or dementia or many different caregiving topics. And we also encourage people to create an action plan using an Alzheimer's navigator to help you figure out what some of those next steps may very well be. We've put a link in the chat to access a special web page compiling all the resources that we mentioned during this webinar. And if you're pre-registered for this webinar by giving us your email address, you'll receive a follow-up with all of this information as well. So as we think about getting support and opening up this conversation so that others can help you, Arthina, I'm curious, why was it important for you to see a doctor about the symptoms you were experiencing?
It was really important, Stephanie, because the first thing was my father and 6 of his brothers and sisters had Alzheimer's. And so it was like a generational thing that was going on with me. But the most important thing to me was because with me knowing that, I wanted my children and my new grandchildren to not have to suffer or to go through what I'm going through now. I wouldn't want this, in all honesty, I would not want this disease for anyone. I would not want anyone to have to wonder every day what's going to happen tomorrow. I don't want them to wonder, am I going to wake up and not know my name or know what today is? I want everybody, so I'm very, very adamant about that with my children. If you find there's a problem, if you can't remember, I don't care if it goes on for a while, please go to the doctor, please. Just, that when I say that, and I think if it wasn't for, and I say this and I always get real teary when I think this, but if it was not for the Alzheimer's Association, I would not be where I am now. My husband tells me that every day. He praises them. He praises them more than I do, because he was so adamant now that we thought at this point at this stage, 5 years, that I would not be where I am now. He always says if it wasn't for the Alzheimer's Association, I would be at home laying in a bed, not talking. So I say, if you have the opportunity, if there's any issue, if you have a parent, if you have children and there's an issue, please go, because they have given me everything that I need. They started me with just a small group. I went to the early stage with my early stage brothers and sisters. and I've moved on. So I say, I can't press this to please call. It's a free number. I called, and that's where I started. And that's where I'm going to keep going, because it's all about knowing.
Oh, it is. And I so appreciate your candor and your courage for bringing forth your story, because I am confident you will inspire others to really share with others in their family, other neighbors, other friends about what's happening in their own world. And Pippi, I'm curious from your perspective, you have connected so many people to help and resources. What do you hear consistently that people really need in navigating that diagnosis and next steps?
I'm going to say our biggest that we need to have out there, Stephanie, is just awareness itself, because awareness will get you to the next step. And our website, alz.org, you can't go to a better resource. We have so many things happening within the organization that were not there for my family when my mother was dealing with this. And we need to make sure we have those conversations, and for people to not only educate themselves, but to educate others. I think that is just something we need to all follow up on at all times, because the person that you don't know needs to hear what you have to say will be standing there next to you, and ask the right questions and go to the right place to find the answers.
So true. And, so much of this starts with education, which is why I applaud every one of you for joining today. Even if you just are clear about the difference between Alzheimer's and dementia after this webinar, that's a great start. And, we're getting so many questions on Facebook Live and through the chat. I want to turn to some of those questions now. And probably the most common question that we're getting is, well, how is Alzheimer's or dementia really diagnosed? And, we always say it starts with talking to your primary care doctor, your internal medicine, your healthcare provider, whomever that is. You want to start with that conversation, because there are some very simple in-office screening tools that can be done to help others understand what kind of memory loss might be going on. And, to the point that was made earlier, you don't have to have every one of these warning sign boxes checked in order to bring up that conversation with your regular healthcare provider and suggest that maybe there is something a little bit different with your memory. Once that early screening has been done, many times then a referral is made to either a neurologist or a geriatrician or even a geropsychiatrist to do a deeper level of testing. And that could involve things like scans like an MRI. It certainly is going to involve more memory tests, oftentimes blood tests, to make sure that those other causes of dementia are ruled out and that we really get a clear picture of what's happening. And through that process, you will oftentimes discover that there are more signs there than maybe you really initially first thought about. So that process is incredibly important to lead to the conclusion of not only understanding, is there dementia, again, those symptoms, but if there is dementia, then what type? And if it's Alzheimer's disease, there's medications and FDA approved drugs that are very specific for that. If it's a different type of dementia, then there are different treatment pathways for those different types. So very important to have that conversation first with your primary care physician or healthcare provider, and then go from there. I know that one of the common things that's asked a lot of times as well is about treatment options. And I mentioned that there are a variety of different FDA approved medications, and there are even great new drugs in the pipeline to help slow the progression of the disease. It's important to note that the medications don't remove the presence of Alzheimer's or the presence of dementia, but they're helping to treat those symptoms. And so many people who take those medications describe that they have an easier time thinking, an easier time remembering, just changes that they see and experience in their own selves. So that's part of the reason that we encourage early discussion. It just helps to get those medications started when that's the right pathway for you. So I'm curious, Arthena, from your perspective, what did you experience with diagnosis? Did it start with your regular doctor?
It started with my regular doctor, but he couldn't see it. Because I had been a patient of his for 18 years. He could not see it. And I was so young, I was 51, so he just couldn't see it. And I was referred to a neurologist who said, you're 51. I don't know. I think maybe it's just maybe a thyroid issue or something like that. But he finally sent me on to a neuropsychiatrist who, after maybe 2 hours of testing, I think we got into 3 hours, and he kept asking me all these questions. And I was laughing because he asked me to name 30 animals, and I couldn't name 30 animals. And he thought, and you could almost see the look on his face that something was going. He kept saying, for your educational level and stuff, that's kind of strange. And he asked me to do math problems. So it went on. And finally, at the end of the conversation, he said, and I was in tears because I knew that he knew that something was wrong. And I think after about 2 months of testing and so forth, he came back and said that that's what it was. So that's how it started. But it started out with me asking my regular physician to see a neurologist.
Yeah.
And we went from there.
Yeah, very typical pathway, and such an important conversation to have, right? So that you can figure out what is that next step. And Pippi, one of the questions that came in live, I think is just so critical. It's the question that I hear all the time. Is it possible that symptoms sort of come and go from one day to the next or 1 week to the next? And if someone has a quote good day, does that mean that they don't have dementia? How would you answer that, Pippi?
That would be nice if that was the case. Yes, they do come and go. And during the stages of dementia, as they go in from the first stage into the second, you will see that it is more of a daily incident of what those symptoms are that they have. But yes, it does come and go. And 1 minute you'll think, oh, well, she's okay today. So maybe it was just something we didn't know about. A lot of times a urinary tract infection can have the brain fog that Alzheimer's or a dementia will give you. And so, yes, there are some things. And the quicker you have the diagnosis, the quicker you have a plan and can make the adjustments within your own family unit of how you will execute that plan.
Yeah, for sure. And, to your point, it's easy when you see those fluctuations to almost start to doubt yourself and think, well, maybe I'm being hypercritical of somebody's memory or thinking. So one of the techniques that we often encourage is write it down, write down those instances where you've noticed that something is off, something is different than that person's baseline, so that when you get to that physician visit, you can say, well, here's what I'm observing. And I always encourage whoever goes to the doctor to take somebody with you, somebody who knows you well and knows what is, quote, normal, and then can say, well, here's what I've noticed. Here's what I've noticed. Help the physician try to put those puzzle pieces together, because it's challenging. On any given day, it can look very different in the early stages. One of the questions that also comes in frequently is, now that we have a diagnosis, what do we need to do next? And certainly there are fantastic Alzheimer's Association resources that I mentioned and that I encourage you to consider. Things like getting connected to more education, getting connected to support, whether that means finding a support group in your local area that fits your flavor, or using one of our online support systems. So we've got different ways that we can connect you to other caregivers so that you can learn from others. We encourage you not to sit at home with this disease and just wonder, but take action, right? Take that step to not only understand for yourself and the implications for others around you, but then also get involved with the association so that you can channel that energy and make sure that you yourself are feeling more positive and more upbeat because you're engaged in this big cause. And you're showing, like Arthena has to all of us, how attitude means everything and how you really do encourage others just by sharing your own story. So as we're wrapping up today, I know, Pippi, that your journey with your mom's Alzheimer's ended years ago. I'm curious in your closing comments, what you would leave with others about what gives you hope today.
Wow. Well, the first person that gives me hope is Arthena, because Arthena is able to tell us her journey. When we went back to 1992, I can remember sitting in the doctor's office and saying, what next? And when we left, my dad didn't even want to talk about it. And it was something that was almost hush hush. Nobody had those conversations. You didn't know what to watch for. What gives me hope is knowing that the Alzheimer's Association is there for so many people, that they stick to the mission. They mean a world without Alzheimer's or other dementias. And everything they do is centered around that. We have so much research out there now. We are so close. We're so close to a blood test. We're so close to a Biogen drug. We're so close. And that research that has changed because of the advocacy through the Alzheimer's Association, because we have gone in just a 10-year period from simply having a $408 million NIH budget for research to now $2.8 billion for research. And it is moving very fast. And that gives me hope, and it gives me the space to be able to say to anyone at any time, alz.org, 1-800-272-3900. And your resources are there, because sometimes you don't have those resources and you are never alone.
That is such a wonderful testimony, Pippi. And, you know, I applaud you for sharing your story, not just with us today, but I think of all the countless lives that you have helped because you've been open and you've been honest about this. And what a way to honor your mom's legacy, because certainly she would be very proud to know that this little kernel, this little spark that got started in you now this many years later is still going to help others. And Arthena, I want to ask the same question of you. You've said before that you don't want your grandkids to experience this and that you don't want anybody else to experience this disease. So what gives you hope?
What gives me hope is that even though it may not be in my lifetime that this disease may go away, I just continually hope that I can tell as many people. What gives me hope is knowing that I can tell my story. I can tell my story. The people who are in my early stage group, they can tell the story. You know, people who have it now, because we have so many people now who are going through this journey that are younger. So they can tell the story. And as long as you are telling the story and telling the story to, because one person will tell another person who will tell another person. As long as we can tell the story, let people see that even though we have this disease, we're living joyfully with it every day. And so therefore it is not anything, because the biggest part that we have, the problem we have with Alzheimer's is a stigma that nobody wants. Like Pippi said, they don't want anybody to know. I don't want anybody to know. Well, now people are less having a problem telling people, I have this. I have it. I'm living with it. You may have it. So if you can get the people out of the closet with it, that makes it so much better. So my biggest hope is that by the time my new grandson, who is 2 months old, by the time he is, even as he grows, eventually it will be a word. They'll be like, what was Alzheimer's? No more. That's what I hope for.
Well, you, Arthena, and Pippi are such inspirations because you are telling your stories so well. And it truly gives me hope that not only will we conquer this disease, but that we someday will have that world without Alzheimer's. And as we're, wrapping up today, I just want to thank both of you for sharing with such great candor your story, and to everybody who paused for a moment today to attend this discussion and think about what it means in your life. I want to thank you. I appreciate you for taking the time. We're glad you made the time to join us, and please know that the Alzheimer's Association is here. If you need additional support, either online or in your own community, go to the Alzheimer's Association website, alz.org, and you'll get linked to those. And for additional resources, tip sheets, trainings related to the 10 warning signs, and updates on future sessions like this, please visit training.alz.org/ALZ Talks. Thank you for joining today.